Today, despite being non-vegetarians, most of them are B12 deficients. We have been seeing a lot of celebrities taking IV therapies. It's for recovery, improving mitochondrial functions, to reducing oxidative stress. I think it's beyond just covering deficiencies. We have been seeing a lot of celebrities and high performance individuals taking IV therapies, not just for covering nutrient deficiencies, it's for recovery, improving mitochondrial functions. It could simply mean providing enough energy within the cell to improving cellular function, to reducing oxidative stress. Some molecules can help in boosting liver function. I think it's beyond just covering deficiencies today. There are a lot of concerns around oral supplements. It is fantastic to always take a easier path than a very invasive route for sure. But today, the lot of problems or challenges we are facing is impaired gut function or reduced enzymes. Whatever we eat do not absorb today. It also depends on a scenario where are we willing to improve the deficiencies, then IV is a better way because it is going to bypass all the first pass metabolisms. And there are a lot of individuals who could have MTHFR or methylation related gene mutations which would hamper their activation of vitamins after consuming as supplements. For example, today, despite being non-vegetarians, most of them are B12 deficiencies. So it could be stomach acid problems, it could be enzyme deficiencies, it could be insufficient intake via nutrition. These are the various reasons that could hamper their oral absorption of nutrition or supplements. In these cases, IV would be a better answer for the individuals. The lot of deficiencies that we often see in most of our individuals are L-carnitine deficiencies, impaired omega 3 to 6 ratios where they are more pro-inflammatory, and magnesium deficiencies are global, universal Indian problem being iron deficiency in a lot of women. For them, having a blend of vitamins, minerals and amino acids together to address the deficiencies will solve a lot of problems. These days, we are talking about a lot of molecules like NAD, NAD plus, NADPH. As we grow older, as we turn 40, the NAD levels decline, and it declines at different rates for different people depending on their health challenges, depending on the chronic disease burden. Some could have depleted levels earlier in their life than it should be. For that, there are various solutions. If the gut is well, they can replenish with oral forms of NR or NMN, or if that is not a possibility, then there is IV NAD. And there are diseases like Parkinson's, for example, which has mitochondrial dysfunction, which means they have very less reserve of NAD. These are the individuals who may need IVs. Yes, there are situations where IV should be contraindicated. For example, having allergies to, for example, individuals who have chicken allergy. There are also other individuals in whom I don't encourage IV nutrition is having very sensitive gut, moderate or severe form of autoimmune diseases. These are the individuals who are very reactive and show up with a lot of acute problems after giving IV infusions. For example, there are Hexheimer like reactions that can develop where they react to commonly given vitamins like B's and C's. They could show up symptoms like fatigue, fever, or even severe cramps in the legs or severe body cramps. Overall, it's not just about fixing what is missing, it's about improving your cellular pathways. For some, it could mean replenishing those energy crashes. For others, it could be reducing neuroinflammation. IV nutrition is not just a drip therapy to cover deficiencies, but it is much more than that.